Good morning, everybody, and also to the people who are online. Good morning, good afternoon, good evening. A very warm welcome to this session where we are hoping that we can launch a newly established thematic working group on climate resilient and sustainable health systems. This group is basically one of the 10 thematic working groups within Health Systems Global. I'm not sure how many of you on the call and in the room are aware of this thematic working groups, but we will be sharing the links to these to the HSG website where you can find out a little bit more about us. The outline for this thematic working group is over 4 years, and hopefully you will find out more about what our plans are over the next 60 minutes. I will also take this moment now to introduce our chair today, Professor Chris Eby. She's a professor at the University of Washington. She brings over almost 25 years of experience in conducting research and practice on the health risks of climate variability, but also strategies for responding to it. She has supported multiple countries in their risk and vulnerability assessments and also supported countries for the development of the health components of the national adaptation plans. She's an author of multiple national and international climate change assessments, including the 4th US climate assessment and the IPCC special report on global warming of 1.5 degrees, which I think many of us have learned very essential lessons from. So over to you, Chris, and thank you very much for chairing this session.
Well, good morning, everyone. Really appreciate your interest in this official launch of this thematic working group. You're here, I'm sure, because you're aware of the extensive risks that climate change presents both for our health and for our health systems. And this working group is going to be critically important to help move forward the agenda, better understand where we understand enough so that we can scale up actions that are already being taken and where additional actions will be extremely beneficial to protect and promote human health in the face of a changing climate. I am delighted that we have such a stellar panel today, and I'm going to give you just the overview of the real expertise we have with us today so that we can spend most of our time listening to the presentations. You just heard from Revati. She's the head of the Climate Change and Health Group at the UK Health Security Agency, and we'll hear from her again in a moment. Suzanne Mayhew is the professor of health policy and reproductive health at the London School of Hygiene and Tropical Medicine. Kabir Sheikh is policy advisor at the Alliance for Health Policy and Systems Research. Jonathan Drewry is the Climate Change and Health Advisor for the Pan American Health Organization. Major Clemens Buter is the Pan American Health Organization Advisor for Planning and Operations. And finally, at the end, we'll have some remarks from Kelly Saldana, who's the Director of Health Systems at the Bureau of Global Health at USaid. And with that, let's get started. Revati, would you like to start with the first presentation and give us more detail on the thematic working group? Thank you.
So I think the main objective of the thematic working group is to build momentum between practitioners, policymakers, and academic researchers to move from risks to resilience. And I think that is the key thing that we would like to achieve over the next 4 years. Okay, so the other challenge that we have is, of course, the conceptual immaturity that we are struggling with, which makes operationalizing resilience within health systems quite a challenge. And of course, we have seen quite a bit of transition between how we have understood, right, starting from the 6 building blocks of the health system strengthening concept to moving to the operational framework, which came in 2015. And now, of course, this year, the shift of looking more at the facility. And that also kind of, brings to front the importance of locally led adaptation and how are we strengthening the environmental sustainability and the infrastructural integrity of healthcare facilities in improving our ability to respond to the health impacts of climate change. And of course, in parallel, we've also seen drip feeding of systems thinking concepts into health system strengthening, which of course started around 2009. But how do these concepts converge? And how can we use this to better understand the impacts on the health systems, but also our ability to strengthen them over time? And then, of course, when we talk about resilience, we talk about return to baselines. And then we've seen from the pandemic as well that which baselines are we referring to? And how are we going to measure progress? And what kind of indicators can we then develop for the follow-up of understanding how health systems resilience is improved? So I think these are some of the key issues that the thematic working group would like to explore together with all of you in the room and online, and also researchers globally. Next slide, please, Emma. Yeah, and then what we're essentially calling, and I think health professionals around the world are calling for this, for urgent collective action, and not just from researchers, from practitioners, but also from policymakers. And I think bringing them all on the same table, and we've talked about this for decades now, but as everybody said, it's time for action. It's again, that whole thing about moving from risk to resilience. So our hope will, of course, be to support health systems in dealing with this challenge that they have, that given the gaps in universal health coverage, the healthcare needs, the rising healthcare needs, health systems really have to have that choice between scaling up their functions, but also keeping emissions down. And how do you then join up the adaptation and mitigation conversations within health systems globally, who are already overstretched? Part of our activities over the next 4 years will focus on collectively strengthening this knowledge ecosystem, learning from each other, bringing people from different settings together. And we've seen that no health system globally is resilient. And we've seen that just for one health exposure now since pandemic, but there's more to come. And every system needs to learn. And I think that's what we will try to foster partnerships, strengthen existing collaborations, and bring newer people to the table to discuss these challenges. And then, of course, the idea will be to collect evidence case studies, evaluated evidence of case studies, and a lot of efforts of these are already ongoing from the WHO, from other academic institutions as well, but we will aim to kind of synthesize them collectively and bring them in some sort of collective evidence together. And then I will end with just one more thing about, we've heard a lot about health sector leadership as well, you know, raising the voice of health professionals and including them, bringing them to the table for discussions around climate mitigation and action. So this is in a very kind of, you know, a satellite view of what we will be planning over the next 4 years. And next slide, please, Emma. And the overall objective of the thematic working group is, of course, to promote policy relevant action-oriented research and practice, and of course, something that involves action on the ground. And I know that we've heard this several times, but in terms of improving the resilience of health systems, we are quite in its early stages. And we hope to achieve that over the next 4 years. Next slide, please, Emma. And I will end with saying, before we go into all the other brilliant presentations today, that we do give out this call for increasing membership of this thematic working group. The link will be sent to you. And of course, we would like to establish regional chapters. We have conversations, ongoing conversations for an East African chapter, a South and Southeast Asia chapter, and a Europe chapter. And of course, Health Systems Global will have its next biannual symposium in Bogota in Colombia, November next year. And we look forward to have a learning lab there for 2 days where we will talk about the methods of assessing the risks in health systems and also what kind of evidence we build from now until then in strengthening the resilience within health systems. Thank you very much. And over to Susanna.
Thank you, Vati. Next slide, please. Is it there? Yeah, thank you. So one focus of the thematic working group is a better understanding of the role of communities in building resilience and sustainable health systems to respond to the both acute and chronic effects of climate change as felt sort of on the front line. And the experience of the past few years in various pandemic outbreaks and the emergency responses to those have highlighted lessons around the importance of working with frontline communities to successfully tackle crises. So I and many others have been involved in work on the Ebola outbreaks in West Africa and DRC, and now we have COVID across the globe. And two critical lessons come out of those, I think. First, that the first people to respond to a crisis are frontline health workers and the affected communities. And they learn rapidly, and they have the best knowledge of what can be done and how best to deliver support. And they must inform responses of the international community, but they're not well built into formal health systems responses. And the second lesson is that without meaningful engagement of local staff and affected communities, emergency responses can fail and resilience will not be built and will not be sustained. And therefore, next slide, please, it's critical that we understand better how health systems can effectively involve people at the front line. There's a lot of lip service paid to community engagement, but too often it's about talking to communities rather than working with them, and certainly from learning from them. And we need to understand how we can build health systems that are responsive and that meaningfully work with people at the front line. It's not easy. There are no blueprints, and there are few robust case studies as yet. And effective adaptation cannot be siloed. So people's lived experiences don't separate health issues from loss of livelihoods or loss of their homes. So we need to understand how we can work effectively across sectors. So how does the health sector work with agriculture to understand how changing climate means we need to be growing different kinds of nutritious crops? How do we work with meteorology for early warning and preparedness? So there are many health systems questions that arise from this that we need to examine, and we need to start from the front line in order to know which are the most important to engage. There are many promising community engagement and adaptation models already in existence, and a key aim of the thematic working group is to build the evidence base of case studies of successful climate adaptation for health systems. For example, I lead an NIHR-funded global health research group called Partnerships for Resilience, which is building case studies of how communities respond and how health systems can support that. But we'd like to hear from other groups, big or small, to provide case evidence about what works, but also what doesn't work and how we can improve and contribute learning in other ways. So as Revati said, we're asking for new members when we're asking people to get involved, and we're particularly keen to hear evidence from the ground, from frontline and affected communities, and from local health workers as well. And then together we can build a critical evidence base that we can then use to create better, sustainable, resilient health systems into the future. Thank you. Back to the chair.
Thank you very much. Really appreciate those very helpful introductions to what's going to be some exciting work over the next few years. With that, we would like to hear presentations. We'll start with Dr. Sheikh at the Alliance for Health Policy and Systems Research.
Thank you very much, Chair. First of all, let me congratulate Revati and Susanna on the launch of the thematic group. And thank you for also inviting me to this panel. So it sounds like a very ambitious mandate that you've set out. And I think these are really strong directions around working with people at the front lines, and I think they're the right directions. It'll be a great new addition, I think, to the complement of working groups at Health Systems Global. And looking forward to seeing this group really stamp its presence over the next few months and years. So for those of you who don't know, I work at the Alliance for Health Policy and Systems Research, which is a partnership based at the World Health Organization headquarters, with the mandate of helping to strengthen evidence-informed health systems worldwide. And we have a focus on low and middle income countries. In this next segment, I'll talk about learning health systems, which is a focus of work that we've been developing at the Alliance. And for me, it highlights a key attribute and the type of investments we'll need to make if we are to achieve climate resilient and sustainable health systems. I'll start my presentation by going over some of the concepts and the reasoning behind this work stream, and then conclude by drawing on the frameworks that we've developed to identify some actions that are more specifically needed to enhance climate resilience. Can I have the next slide, please? So first, a little bit about the origins of this work. So as I said, our mandate is to strengthen health systems in low and middle income countries. And in 2019, we convened a meeting of policymakers and experts, mainly drawn from low and middle income countries, around the subject of learning health systems. And the consensus was that learning is a critically important area of focus in health systems, but also that currently many health systems have a learning problem. So we recognize, the advisory group that we put together recognized that there is a growing consensus that learning is crucial for the performance of health systems. So there is a momentum and an interest in learning in the learning health system. However, there's still the absence of a shared understanding of how health systems learn, or indeed of how to improve health systems learning across different contexts. So that's the main gap that we look to fill and that we were tasked to fill, and that is to develop the science of learning health systems better, especially building on the significant body of existing theories and frameworks of learning organizations and learning systems, which is a field that's existed for several decades, but hasn't been adequately applied in the context of health systems. And second, to provide stakeholders with clarity on concrete actions that they can undertake to advance learning health systems. Next, please. So this is the cover of our flagship report, which was published in September this year. And as I said, the report builds on not only on theories of learning organizations and learning systems, but also on the current understanding of health systems as it's been put forward by the World Health Organization, in that they span many functions and structures. They should be centered around people and oriented towards health equity. And the report is now available in both downloadable and interactive format on the Alliance's website. Next slide, please. So one of the core frameworks in this report illustrates how learning occurs across 3 dimensions. And I'm going to talk through those, and these are as follows. So learning occurs at different levels of the health system, right from the individual level to the team level to organizational and cross-organizational levels. The second dimension is how learning takes place. And we, of course, recognize that we generally tend to associate learning with the transfer of information. And of course, that is an important means of learning, but equally important, learning also takes place through deliberative practices and also through the actual action and praxis of working in health systems. And these are under-recognized and underutilized means of learning, which need to also be given equal importance. And finally, and this is a crucial concept, there are different types or loops of learning that can take place. So I'm getting into a little bit of technical territory, but it's an important distinction to make. Single loop learning is about learning to change routine practices, whereas on the other hand, double loop learning changes the way we think about core assumptions and can lead to new policies and strategies and not just improve their implementation. And triple loop learning is actually about changing the way in which systems learn altogether. So it's about building new learning systems. Next slide, please. So again, this looks like a busy slide, but I'll draw your attention to the right-hand side, the potential benefits of learning health systems. There is, of course, a lot more in the report that you can access, and I will point to those links again later in the presentation. Currently, however, learning activities within health systems are largely focused on single loop learning. That's adjusting regular actions, enabling more informed practices. And of course, this is important because this is how health systems functions improve at all levels, enabling individuals, teams, organizations to enhance their regular practices and perform their functions more effectively. However, many health systems falter when it comes to double loop learning. And this is what is needed to confront challenges, wicked challenges such as climate change. So double loop learning is about challenging the assumptions of regular policy and practice and enabling more aware, critical, and self-corrective practices. Double loop learning prepares health systems for change. And there are 2 parts to this aspect of change preparedness. The first part is adaptation, which is about developing the predictive capabilities, improving resilience, building the systems that will resist future challenges. And the ability of health systems to anticipate and respond to changes in internal and external contexts is an important asset that emerges from this, and climate readiness is one of the most important of those contexts. On the other hand, we have innovation, which is where systems themselves drive change through a culture and policies that welcome experimentation and has ways of assessing, integrating, and scaling up good practices and helpful technologies. And thirdly, and also critically, learning supports self-reliance. So learning health systems are those that can set their own priorities, define their own frameworks for action, and optimize their use of existing resources as they're less dependent on external actors. Next, please. So those were a bunch of frameworks and theories. How do they actually help us in terms of understanding what is needed to build climate resilient health systems? So here I'm taking this multi-dimensional framework of learning health systems. You'll see one of the dimensions up on top, the information, deliberation, and action. Those are the means. And you'll see the loops on the left, single, double, and triple loop. And what we've done here is we've mapped the different types of learning interventions that need to be institutionalized, or in other words, routinized through different rules and procedures if we are to build a learning health system. And then what we can do is we can overlay a specific challenge, in this instance, climate change, and identify the specific interventions that need to be institutionalized to address that challenge. So I should note here that these are quite high level for purposes of presentation, and this is not really diving deep into the actual types of interventions, but more overviewing the types of interventions that can take place. And I'm sorry if the slide is a bit small, but I'll read through some of it. Can I have one click, please? Perfect, thank you. So at the face of it, when we think about climate change, the important learning interventions are about routinizing information flows. So I've highlighted 3 of these information flow type interventions: creating specialized units that track the health impacts of climate change, strengthening and aligning monitoring and evaluation systems, and improving how that data feeds into decision support systems for decision makers, right? So these decision makers could be policy planners, managers, and even healthcare providers when it comes to the impacts of climate change. Can I have one more click, please? But then when we shift the lens to include the other dimensions, which are not just about information flow, we see that there's a much wider spectrum of learning interventions that needs to take place, and that becomes relevant here. First, you need tech assessment platforms to test interventions and technologies for readiness for scale up. You need to share climate solutions across communities of decision makers. You need policy and systems research, and this is where the Health Systems Global Thematic Group could become particularly important. You need multiple sectors working together for a common working group. And at the bottom of it, you need a learning strategy in place to ensure that all your interventions have the needed coherence in serving the common learning goal of climate readiness. Next slide, please. So I'd like to conclude with one message, and that's to address this neglect of learning in the context of health systems. Investments in learning are a very small proportion of overall investments in health systems and programs in LMICs. And if we are to develop climate resilient health systems, we'll need to build institutions, but also the human capacity to prepare for and drive change, and not only to react to it. And for that, learning investments need to become an integral part of our approach to health system strengthening. Currently, they're not. And so that was a little bit of a flavor of the work and the frameworks that we've started to develop. We'd be happy to share more plans and details and take forward conversations. Back to you, Chair.
Thank you very much. That was an excellent overview of what needs to be done in learning for health systems, critically important. And thank you very much for bringing in the triple loop learning. There is a lot that can be done relatively easily to help facilitate that triple loop learning, and we need to obviously do it quickly. With that, we're going to hear from Dr. Drewry, who has extensive experience in the Pan American Health Organization with helping build climate resilient health systems. Dr. Drewry?
Hi, everyone. Hope you can hear me. Pleasure to be with you all today. I'm going to spend the next few minutes just giving a little bit of an update on an interesting project that's been underway in the Caribbean for about a year now, called Strengthening Climate Resilient Health Systems in the Caribbean. And it's funded through the European Union with support from CARICOM, CARIFORUM. And it's a very dynamic project in the sense that it stands to bring to the Caribbean real transformational change along a number of the areas that we really need to develop with strengthening health systems. So next slide, please. So in the Caribbean, as we know, there are a lot of challenges for the health sector. We have the climatic impacts of unprecedented heat, drought, flood, intense storms, sea levels. There's also an issue with research in the Caribbean, being one of the subregions of the Americas with less research in climate change and health compared to the others. And the translational research is something we need to build on also. There's also demand on some of the most vulnerable populations, outdoor workers, athletes, coastal communities. As was mentioned a minute ago, the vision and the leadership for the health sector is important to build climate resilience and to establish that. And also the economic sectors, being tourism, agriculture, and others, are very sensitive to climate and health. And there is not a great deal of work in the mitigation area. So that's something that needs to be promoted. Next slide, please. For the Pan American Health Organization in the Americas and in the Caribbean, these are some of the areas we work on towards climate resilient health systems. So some of these are the formation of intersectoral groups working on health, planning through vulnerability and adaptation assessments, health infrastructures you'll hear about in a minute through smart hospitals, early warning systems. How do we look at the immediate health co-benefits and bring that evidence to the forefront? How do we train environmental health officers? Also the importance of bringing health financing. So just a few of the areas that PAJO is working on. Next slide, please. So this project, as you can see and appreciate from the top of the screen, brings together a number of key partners from the Caribbean. PAJO is leading this effort with funding from the European Union and CARICOM and CARIFORUM, the Caribbean community. Also the Caribbean Community Climate Change Center in Belize, the Caribbean Public Health Agency in Trinidad, the Caribbean Institute for Meteorology and Hydrology in Barbados, University of West Indies, and other UN organizations. So this project aims at these main outputs of having more of a Caribbean, a pan-Caribbean intersectoral approach, really promoting comprehensive health adaptation plans, raising awareness about climate and health, looking at how we begin to measure the health co-benefits, focusing on things like water, sanitation, and food safety that are really influenced by climate, and how do we make those systems more resilient. Climate-informed disease surveillance, and perhaps one of the most important ones is the future of our workforce in the Caribbean, and how do we strengthen that so that we have future leaders that are ready to meet the challenges that lie ahead. Next slide, please. The project covers 16 CARIFORUM countries across the Caribbean, so it is diverse in culture, in language, and geography. Next slide, please. The first few sort of outputs from this project are the immediate health benefits and health national adaptation plans. So in the Caribbean, there is a gap, and that gap is really that there's not a lot of evidence for climate mitigation as it relates to things like air quality, green space, active transportation. There's also not necessarily a system to prioritize what are the leading health outcomes and how do we increase climate financing. The 5 C's from Belize is working with us on the climate financing piece, and PAJO is leading these 2 other areas. So several of the accomplishments from year 1 have been the training of PAJO WHO tools to help countries gather evidence on how is air quality affecting health, how is green space, and how can they promote active transportation also to promote health while addressing the climate. Also, we've started the process of piloting AirQ Plus tools, linking health impacts with emissions in a number of countries. We've trained all of the CARICOM countries on how to develop comprehensive health national adaptation plans. And 6 countries have been selected to plan the HNAPs at the national level, which has already started the formation of interministerial committees, communication plans at the national level to get this information out to the public, and also ideas for financing. Next slide, please. So developing climate-informed surveillance and risk monitoring systems. The gap there is really systems that are able to link climate and health and data, really to enhance public health and be able to address the needs of vulnerable communities. So CARFA and CIMH have been leading this effort with support from the other partners, but we've carried out assessments of national surveillance systems and selected 3 countries for the piloting of early warning systems. Baseline assessments are being underway for water, sanitation, capacity, infrastructure, and readiness. Process to develop videos and manuals related to climate resilient water and sanitation plans, and assessment of what are the current emerging food safety risks related to climate change and baseline surveys. Next, please. Leadership. So this is a critical area, is the gap of having leaders that have the interdisciplinary skills and really understand how to develop climate and health solutions. So working with University of West Indies, they've developed a leadership curriculum and initiated the first cohort of One Health Fellows across different sectors that will be trained over the course of this year and next year on climate and health concepts. And they'll be doing practicums in their countries. They'll be designing symposiums and doing community-based projects also. CARICOM youth ambassadors are also being engaged in this project and trained in climate and health. They also will engage at the local level for community projects. And we've also brought together different youth groups from across the Caribbean under a platform to look at climate change and health. Next slide, please. Communication. So communicating climate change and health to the Caribbean people. Really the gap here is how do we reach those target populations of youth, of healthcare providers, of non-health sectors about the importance of climate health and the environment. So we have a robust communication and visibility plan under this project. We've had inception events, we have branding materials, we have social media cards, as you've seen on these slides, jingles, videos. We've initiated partners and journalist trainings and developed different human interest stories and translated those into French, Creole, and Spanish and Dutch. And we did a public perception survey several months ago across 10 countries to see what are really the knowledge, perceptions, awareness of almost 3,000 respondents in relation to climate and health. So that yielded some interesting findings. Next slide, please. This is just an example of an event we held a few weeks ago with over 25 partners across the Caribbean, sponsored by Yale, Earthmetic, and many others, as you can see here. But it was a really dynamic and innovative 4-day conference to really promote research, the research and the practice agenda in the Caribbean. So I think that's an important one that we'll be hearing more about later. They'll be presenting later next week. So to summarize, some of the key project contributions have really been the importance of climate change. Next slide, please.
Jonathan.
Yes.
Wrap up, please.
Okay, next slide, please. So the key project contributions have really been placing an importance on climate change and health projects that engage multiple agencies, sectors, and countries, generating data, opportunity to scale up climate and health implementation practice in the Caribbean, and then providing countries with evidence and priorities to really elevate health and facilitate inclusion in national planning. And last slide, please, is just a list of those of us that are involved in this project from PAJO. Many other partners have contributed. And to learn more, please visit the website at the bottom of the slide. Thank you very much.
Thank you. This is going to yield very important results. We look forward to hearing more as you engage across the project. So thank you. And then we're going to hear from Major Clemens Buter on planning and operations for PAJO.
Thank you very much for the kind introduction, Professor Ebai, and good morning to most of us, I think. For some of us, good afternoon. And I thank you for the great opportunity to, on behalf of our team, to present the Smart Hospital in the Caribbean project during the next 8 minutes. I think this presentation is a great practical example of a climate sustainable and resilient health infrastructure system. As you can see on the picture, that's the recently handed over smart facility. It's the Drewry healthcare facility in St. Vincent. The project is funded by the UK Foreign Commonwealth and Development Office in the amount of £46.3 million. It's implemented by the Pan American Health Organization in very close collaboration with the Ministries of Health. And as previously mentioned, the Caribbean is hit by natural disasters every year. And in the event of an emergency, health facilities to treat the sick and injured are of course really vital. But over 2/3 of hospitals are in areas of higher risk of disaster, and health services are frequently disrupted following storm, hurricane, earthquakes. We have heat waves. Recently, we had the eruption of the volcano in St. Vincent. Of course, we have the pandemic. And climate change will even further increase the level of risk in the Caribbean. Next slide, please. More than 67% of all the hospitals in Latin America and the Caribbean are in areas at high risk for natural disasters and climate change. At the same time, hospitals represent almost 70% of the Ministry of Health national budget. In the Americas, 61% of the impact on health facilities is caused by earthquakes, 17% by hurricanes, 40% by floods, and 8% by health emergencies. Of course, we have the heat waves, the current, and these numbers are even outside of the current pandemic. But it leaves millions of people without proper health care and resulted already in billions of dollars in costs. Next slide, please. In phase 1 of the Smart Hospital project in 2013, 2 demonstration retrofit projects were done. One at the Georgetown Hospital in St. Vincent, which was an older facility, and the second one at the Boxen Hospital in St. Kitts, which was newer, but both of which proved to be very successful. The retrofitting works included the replacing the windows to meet higher design wind speeds for this region, strengthening of the roof to accommodate solar panels and ashfall in St. Vincent, improving the natural lighting and ventilation, and improving the fire safety and emergency egress of the facilities. 10 months after the completion of the Georgetown Smart Hospital, the energy data was reviewed, and there was an estimated 58% reduction in the electrical consumption. Similar checks were done at the Boxen Hospital in St. Kitts, and in that facility we saw a reduction of 50% in the utility bills. Phase 2 of the Smart Healthcare Facilities in the Caribbean project started in June 2015 and is currently implemented in 7 project countries: Dominica, Grenada, St. Lucia, St. Vincent, Belize, Jamaica, and Guyana. The project ends in December 2022, and as you can read on the slides, we aim to achieve the following results. Of course, the enhancement of safety standards, reduce downtime and damage to hospitals for natural disasters. I think the recent volcano eruption in St. Vincent was a good example, and the impact, or the not big impact, on our facilities there. Lower operating expenditure due to water and electricity consumption savings. And we would like to promote nationally, but also regionally, our smart standards. Next slide, please. So what is a smart health facility? It's both safe from natural hazards and it's green. There are several win-win ways to accomplish this, in which in the process can be cost effective, cause a reduction in greenhouse gas emissions, achieve climate change adaptation measures, risk reduction, and development benefits. The image shown in the presentation defines what is meant by smart. It illustrates that improvements in safety, or an A score on the Hospital Safety Index, results in a safe facility. A score of more than 70% on the green checklist equals a green facility. The graphic presents safe and green factors to consider, and when these are combined, help to create a sustainable, smart facility. Other measures, such as the use of eco-friendly flooring, paints, furniture, furnishes, will further contribute to increased sustainability and risk reduction. Health facilities can also improve their smartness by greening their operations, including the use of less paper, recycling, generating less and properly disposing of waste, solid and otherwise, proper disposal of pharmaceuticals, using environmental benign chemicals, and use more local, sustainable produced food. Next slide, please. During the next 4 slides, just give me a brief update on where we are with the project. So we have 3 outputs. The first output is mainly focusing on assessments and training. I already mentioned the Hospital Safety Index and the green assessments. So we assessed over 400 healthcare facilities in the Caribbean. We currently are retrofitting 55 of them. So there's still plenty of opportunities for other donors to move ahead with this project. Very important, and I included the link in the slide as well, is the various technical guidelines and all the case studies. Important, the maintenance. Of course, we all know in the Caribbean, maintenance can be a challenge. So we put a lot of effort in providing maintenance courses, including a manual for preventative maintenance, but also practical courses. In output 2, which focuses on design and retrofitting, I mentioned the aim is to finish 55 facilities by the end of December 22. Currently, we aim to finish the first 50 by the end of this year. And in the picture, you can see same picture as the first slide of the presentation, but this clearly shows the before and after picture. So the result of the retrofitting works. Next slide, please. Also important to say that the project itself, it's not only healthcare facilities, it is healthcare facilities, so not only health centers, it includes places that take care of the elderly, children at risk, and mentally disabled. Also, central medical stores are part of the project, which of course is vital to store strategic medical supplies, including the vaccines. And again, thank you for the opportunity to present this project, because output 3 is on PR, external linkages. And we're extremely happy that we see that other donors, other sectors like education and tourism, they start to take over the concepts and they start to use the technical guidelines as mentioned. You can find us on the internet. Of course, we are on social media as well. One thing I would like to add is the training. It's a bit of PR, but when people are waiting, patients are waiting in the waiting room, we also put a lot of emphasis to train the people while they're waiting anyway, of what they can do. We learned in other presentations of the importance of the communities. We heard about learning, and I think this is a great way as well to really teach people who visit the facility of what they can do themselves as well. And even by installing some LED light bulbs, it can make a huge difference already in their own homes and a positive impact on their utility bill. Next slide. So some challenges. Of course, we all face the challenges of COVID-19, but for a construction project or a retrofitting project as we are faced with the travel restrictions, which impacts kind of the travel of our experts as well, the engineers, just to make sure the quality is up to standard. Of course, the ministries of health are all really busy with the impact of COVID-19. So the absorption capacity is at the moment more limited. I mentioned quality assurance. I think it's extremely important to have our technical engineers, but especially the check consultants, as mentioned in point 5, just to review everything that has been done by design firms, but also by the contractor to make sure that everything is up to standard. Talking about standards, it's important. Building codes and standards, they are there, but especially the application of those codes and standards is important. And I mentioned training, so the importance of contingency plans, SOP, but also rehearsals with the health staff to make sure that the functional aspect of the project is also covered, and that the staff know what they have to do when a disaster happens. Last slide, please. Then the future, as I mentioned, we are very pleased to see that donors and other sectors, they start to adopt the project. We see, for example, that the new courthouse in BVI is also is going to be a smart facility. We see the education sector, as mentioned. Also, we are now working on a guideline for new facilities. So, as mentioned, as funded by FCDO, we only do retrofitting, but now we're working on new facilities. 2 nice examples are the 2 new shelters funded by the EU in St. Martin. And we see a broader interest from the private sector. So we are really capacity building. And as I mentioned, the patients who visit the healthcare facilities, that we teach them as well how they can make a positive impact at their own homes. So we're looking forward to expand the project. And I think that's my last slide. So I would like to give the floor back to Professor Ibai. Thank you.
Thank you very much. That's a very impressive demonstration of how one can start scaling up activities, but also taking the holistic approach we've all been talking about from the beginning of thinking about, for example, training of communities while they're waiting in healthcare facilities. So very thoughtful and very helpful example that other countries could follow as they're looking to build climate resilient health facilities. With that, I'd like to turn to Dr. Saldana for some remarks.
Great, thanks so much. Can we go to the next slide? So yes, I'm not actually talking about funding health system resilience, but more about strengthening health system capacity. I do think it relates to a lot of the messages we've heard. In particular, I noted at the beginning, Ravati talked about how we want to have a convergence of some of the conceptual frameworks, and I think that resonates within USaid. We recently launched a new climate strategy, which sets ambitious timelines and targets for reducing global emissions, increasing adaptation, and mobilizing climate and risk financing as countries seek to adapt to climate change. And so we work on the climate crisis, both in terms of helping to implement ambitious emissions reduction measures, protect critical ecosystems, transition to renewable energy, and build resilience. And then also helping communities and countries respond to and recover from climate-related disasters, including preparing to reduce risks and strengthening early warning systems for climate hazards, helping to take early action, strengthening institutions, communities, and governments to proactively address risk and reduce exposure. So, but even with the best mitigation measures, the effects of climate change affect lives in different ways, both in experienced habitat loss, which potentially increases the risk of infectious diseases, but also diminished resources, which impact livelihoods, health security, and more. So it's important to think about the broader climate context when we start thinking about the capacities and the health system's capacities. Next slide. So this is a conceptual framework that USAID has for overall resilience. And just a couple of key points to note here is, again, so the context of climate change is really important, and we recognize that impacts countries in different ways through a series of different kinds of shocks and stressors on systems, but also on individuals and societies. And really the way that they respond to that is by taking advantage of existing assets, resources, and strategies. But the extent to which they're successful can lead to different paths as a result of the shock and stressor, and then different outcomes. And so what we want to try and do is identify how to support countries on the path to rebounding better off than they were before, and in the face of these shocks and stressors. So I think it's also critical to note that when we start talking specifically about health systems need to be resilient to respond to these time-bound events, such as disease outbreaks, as well as to the longer-term dynamics related to climate change. And we think that to be resilient, a health system must be flexible enough to adjust its resources, policy, and focus so that healthcare can be uninterrupted during times of crisis, both to enable response to the emergency, but also to maintain routine essential services. And so to do this, we really have to invest in the health system in a cross-cutting way. Next slide. So earlier this year, USAID released a new vision for health system strengthening. And what we've tried to do here is to recognize that the ultimate objective of health systems is to produce good health outcomes. And doing that is mitigated by, or is achieved through 3 health systems outcomes that we define as equity, quality, and resource optimization. These are interrelated. One is not more important than the other, and all impact one another. So we want to make sure we're reaching the most vulnerable populations with quality services, and that we align and optimize our resources, including human and financial resources, in ways that achieve equity and quality. Although we try to shift the focus to the outcomes, we still recognize the critical importance of the health system's building blocks to achieve these goals, and identify a series of cross-cutting approaches that we think are critical to enabling this. And that is one, I think recognizing the linkages between communities, the public sector, and private sector across sectors, enabling local organizations to think through and make their own decisions, and then recognizing that to achieve all of this, there needs to be behavior change, both in terms of supporting clients to implement healthy behaviors, but also on the part of providers and managers to promote quality systems in and of themselves. And lastly, throughout this entire process, we promote learning and adaptation of programs and approaches to health systems. Next slide. So these two frameworks come together in really what are these resilience capacities. And so you may have noticed that on the resilience conceptual framework slide, we think it's critical to our approaches to how we strengthen health systems, because ultimately what we want to do is enable the system to absorb a shock or a stressor, to be able to adapt as needed, and then potentially to transform. I think this relates back to some of the points that Kabir made related to the learning health system, and really the extent to which that system can adapt and transform. From a health systems capacity building perspective, we think that it's critical that we don't wait until there's a shock or a stress to the system, but really that we want to build these capacities during sort of what we call everyday resilience. So there's a series of actions and deficiencies that we see within health systems, stockouts of drugs and supplies, health worker strikes, other issues that during which health practitioners can practice resilience during everyday periods, so that they're more prepared when there's an actual shock or crisis. Next slide. So, so the key messages that we promote when we talk about building capacity, resilience capacities within health systems, is that we really want to rethink how we provide technical assistance, and how we can do so in a way that fosters local capacity and locally generated solutions, because we feel this is critical to the resilience capacities. It enables people to think holistically about health systems, to implement the multi-sectoral approach that I talked about, and also to recognize and analyze the role that different stakeholders can play within the system. During recovery and transformation, we recognize that there is a need for the global community to work together to improve the ability of the health system to make the fundamental change that addresses underlying challenges and contextual dynamics, and to progress towards health outcomes. So that includes creating or implementing integrative policies, processes, or structures, which might not have existed prior to an event or a shock. And so really is taking that transformation. And then promoting research and learning throughout the system and throughout the practice of both everyday resilience, as well as response and recovery to specific shocks and stressors. So I want to sort of explicitly acknowledge that there was a recent announcement of the President's Emergency Plan for Adaptation and Resilience, announced at COP26 just a couple of days ago, which aims to support developing countries and communities in vulnerable situations around their world in their efforts to adapt and manage the impacts of climate change, including providing support to build strong and resilient health systems and communities. So going forward on this conceptual convergence, we will use the PREPARE initiative to deepen the global understanding of climate risks, vulnerability, and adaptation solutions, and integrate and mainstream adaptation, and then mobilize finance and private capital. So really, we see this within USaid as a whole of agency approach, but also within the US government as a whole of government approach, where we try to bring together all of the different thoughts and assets we have to working on this. I know we're short on time, so I will stop there and see if we have any questions as we go forward.
Thank you very much for that very brief overview of a real important initiative from USAID. At this point, I know we just have about a minute left. Revati, do you want to take one question from the floor, or should we make sure that we thank our speakers for outstanding presentations and allow people to follow up individually afterwards?
Chris, I'll just ask in the room because they've been patiently waiting. If there is any question in the room that you would like to ask, anybody in the room would like to ask? Anybody in the room would like to ask a question to any of the panelists? Yes, please go on.
Hi, thank you. Thank you for the brilliant presentation. My name is Julius Alejandre. I am from the Philippines, but I'm a planetary health researcher here in Glasgow currently. One of the greatest sources of GHG emissions in the healthcare system is pharmaceutical acquisition or pharmaceutical procurement. In the NHS, for example, 3% of the emission comes from pharmaceutical procurement. So I'm just wondering from the panel, what measures can you propose to cut this emission?
Would anybody like to take this? Any of the panelists? Okay, then probably I will very quickly reflect on this, yes, obviously it is a huge challenge. Yeah, obviously it is a huge challenge and efforts are in place. And I think that is also the balance that we are talking about. So our focus is a little bit more about adaptation. And of course, the sustainability of the health systems is a key argument as well. And I think the moving forward, it's about joining these two aspects. But I personally think that scaling up the adaptation and catching up a little bit on the mitigation side from the adaptation front would be a key as well. Yeah, that'd be my thoughts. I think given the time, probably over to you, Chris, for one final comment, and then we shall close, and apologies that we ran out of time for this session. Over to you, Chris.
Thank you so much. This was just an outstanding session. Really want to thank the speakers for very excellent, thought-provoking presentations, and look very much forward to working together with everybody to promote sustainable and resilient health systems. Obviously a critically important topic as we go into a much different future. So thank you, everybody, and look forward to engaging as we go forward.